Hi there, I'm Amy, a professional fitness trainer and a prenatal exercise specialist.
I'm Sage, and I'm 28 weeks pregnant.
Today we are talking about movement during pregnancy, and we're gonna go through a series of exercises that are perfect for the prenatal period. How have you been feeling, Sage?
Pretty nauseous.
Yeah, I was super nauseous in both my pregnancies as well. Movement was one of the few things that helped ease that a little bit, so I hope you feel the same. We know that exercise during pregnancy has numerous benefits for both mom and baby, and we're gonna talk through some of those exercises today. Our first exercise is 360 breathing. Probably the most important core exercise you could do during pregnancy, also in the postpartum period. It's also a great warm-up because we get the blood circulating, get everything ready to move, and it helps you get in touch with your posture and your alignment. So I'm gonna have you start. Let's put your hands right on your belly, and this is gonna help us feel where we're moving. You'll be able to feel it internally and externally. We're gonna do a big inhale, and as you inhale, I want you to think 360 degrees around. So think of your core as a canister. Try to relax in the shoulders and keep it all through your core. On the exhale, you're gonna bring everything in and up, almost like you're zipping up a pair of pants, lifting up that pelvic floor, everything comes in. Big inhale. As we inhale, expand through your back, through your sides, through your belly. Exhale and lift. And you can even use your breath to help guide that exhale on a shh or s to help lift all the way up and in. Great, how's that feeling?
Really good.
Yeah. You can really get in touch with that deep core, your center, everything that is moving and changing, and help you feel strong as you go into your other exercises. So for our next exercise, we are going to go down to the mat, and I'm actually gonna have you go down on your side and then come down lying on that left side. So this is really great to be thinking about getting in and out of bed, or anytime you go down to the mat, go from your side, roll to your side to come back up, just to reduce that pressure on our core, make it a little easier on our back. So you're here, you can rest that head right down like you have. Hips are stacked, knees and feet are stacked. We're at a 45-degree angle with our knees. You're gonna engage the core, so you're gonna stay stable right through the upper body, and then you're just gonna lift this knee, just opening up, keeping your feet glued together. You're gonna feel it a lot in this glute, and you can go just as far as is comfortable for you. We all get pretty tight and sore in our hips. If we get up about halfway, you feel a lot of glute. We get a little higher, we open up more with that hip rotation, really important as we get closer to labor. And we're really strengthening all through this lower body, stabilizing our pelvis and engaging that pelvic floor. How does that feel for you?
I can really feel my glutes working.
Yeah, so important to strengthen those glutes during pregnancy to help support our growing belly. As we get bigger, we really feel it in those hips. Strong glutes and lower body are not only going to stabilize that pelvis, but it's gonna help you with labor and delivery. Let's stay on the mat for our next exercise. We're going into the bird dog. So I'm gonna have you come on all fours. So the quadruped position, tabletop, knees are beneath the hips, hands and elbows are right beneath the shoulders. And what you can start with is just that deep core breathing, that 360-degree breathing we talked about to get you nice and stable in your core. And then you're gonna reach one arm and then the opposite leg out. So reaching forward, stretching back with the leg, and then we'll switch. So you're getting a nice good stretch, but also strengthening along those muscles along the spine. If you wanna feel a little more core, you can shift your hips forward a little bit. If that's not comfortable and you need a little more balance, you can shift back. For our next exercise, we're gonna take it to a staggered row. So I'm gonna have you turn this way. You're gonna put one foot back, one foot forward, and just think hip distance apart to give you a little bit more stability. We're gonna hinge forward with those weights in both hands, and then you can just bring the elbows up in a row, squeezing in the shoulder blades, core is tight. Thinking of bringing the weights right towards your hips, your rib cage, pulling the elbows in, squeezing at the top. So we're working a lot of those big muscles along the back, the shoulders, keeping the core engaged. In pregnancy, everything pulls us forward, and especially once that baby is here. So the more we can work those back and shoulders, those good posture muscles, the better we're going to feel. Our next exercise is an incline knee push-up. So this is a great modification for push-ups during pregnancy. It's gonna reduce that intra-abdominal pressure on your core. I'm gonna have you come towards the bench. This can be done on a bench, a sturdy chair, maybe the back of the couch, and you're gonna bring your hips forward. And I'm actually gonna have you take your toes on the mat just to dig in, give you a little bit more stability. Take that 360 breathing to lift up on that core, and then you'll just lower down into that push-up position. So elbows at about a 45-degree angle, and then as you come up, you're gonna lift with that core as well. How does that feel for you?
It's working my arms.
Good.
It's working my core.
And we're gonna need those arms. Once that
Yes.
baby's here, you're gonna be using your arms a lot. Next up, we have the squat, a classic exercise and a really great pregnancy exercise. We'll start with your feet wider than hip distance apart. You may even want to turn out a little bit into that plie or sumo squat, depending on what feels comfortable for your belly and where you are in your pregnancy. We're gonna sit like we're sitting in a chair. So driving those hips to the back, getting as low as is comfortable for you. And then as you drive up through those heels, really connect with that core lift with that pelvic floor. Keeping the chest open, sitting low. We're working the entire lower body. So we've got quads, hamstrings, glutes, hips, core. Really great to strengthen everything that's supporting that growing belly. Great stretch and hip opener as we prepare for labor and delivery. And that's a wrap. You did it. Great job working your entire body. How are you feeling?
Feeling really energized and soothed.
Exactly where we want to be. During pregnancy, it can sometimes be hard to know what exercises we should be doing and how we should be doing them. The important thing to remember is that movement is good for your growing body during pregnancy. We want to both strengthen and stretch, not only to support our growing belly and the changes that our body is experiencing, but also to prepare us for labor and delivery and parenthood, which are both extremely athletic events. These moves are safe and effective for any trimester of pregnancy, but please make sure that you have been cleared by your doctor or midwife for exercise and that you talk to them about what is specific and appropriate for you and your pregnancy. It's recommended that we get around 150 minutes of exercise per week in pregnancy. That could be 30 minutes a day, 5 days out of the week, but you can break it up in a lot of different ways. Maybe that's just taking a walk outside. Maybe that's a prenatal yoga class. Maybe that's just chasing your toddlers around the house. Whatever it is, all movement should feel good for you. When we're working out, we want to use what we call the talk test as a way to regulate our intensity. If you can still talk when you're working out and you're feeling pretty good, you're probably right where you need to be. If you start to get out of breath or feel like you're getting overheated, you want to take a step back and reduce your intensity. Bottom line is listen to your body and stop if something doesn't feel good for you. Thank you so much for working out with us today.